KLIF News and Information time is now 7:18. According to the Washington Poison Center, shocking number of children have become sick now after ingesting liquid nicotine, the kind that's found in e-cigarettes. The total number of calls to the center about e-cigarettes is up 600% compared with recent years.
While everybody's trying to figure out whether e-cigarettes are dangerous to smoke, little kids are drinking the liquid nicotine. Let's talk with Dr. Al Johnson at Johnson Medical Associates. Good morning, doctor.
Good morning.
Have you heard about this?
Yes.
What can you tell us? Because apparently it doesn't take very much to make a little kid sick.
Well, exactly. And it's just like any toxic substance. You got to keep it away from the kids. It's a concentrate, and as you well know, they put it in the smokeless cigarettes, and then it's vaporized, but it's vaporized in very small amounts through that mechanism. But in the liquid concentrate, and it comes in different strengths, it can be dangerous to kids. So you have to keep it out of the way of kids and locked up just like you do your medications.
Oftentimes these products look like candy, so I would imagine that really does attract the little ones who are curious about what actually it is. What are some symptoms that your child may have ingested this nicotine liquid?
Well, nicotine is a stimulant, so if they're hyper, if their heart rate is fast, if they're sweating, if they're disoriented, all those things occur if you get an overdose.
Now, my understanding about these cartridges is that they come in pretty colors, and they smell sweet, and they have sweet-tasting nicotine liquid that is ingested because, frankly, they're promoting these things toward teenagers, I guess. So that's the attraction for the young ones, huh?
Yeah, exactly. And the other question is just how safe this is in general, because many of the products used in this, such as coloring and the sweeteners and so forth, are generally accepted as safe for ingestion, but not for inhalation. No one has really studied that. And when you inhale a substance, it acts different, and it's absorbed much more quickly in the body. And how those dyes and colors and sweeteners affect the lung tissue, we don't know. It's just not been studied. So there's a lot of unknown in the whole process of these smokeless devices.
In your practice, do you notice people switching over to these products from regular cigarettes?
Yes, I have. And the ones that I've seen have done it fairly judiciously, just using the plain nicotine without all the additives and enhancers and so forth to actually help them wean off the cigarettes.
Well, you had already addressed the other subject we wanted to bring up, and that was the overall safety of e-cigarettes. And as you said, we just don't know anything about them really, and until the FDA gets a handle on this is going to be a growing problem. Are you aware of any effort to limit these products?
I'm not aware of any effort to limit it, but there are studies going on to really look at what it does and how it may affect the lung tissue with it. I just encourage the listeners to use those judiciously and use it to help wean yourself down off of nicotine from the cigarettes that you've been smoking, and then get off of them as soon as possible, because it is a chemical. It does affect your body, and it can cause lung problems.
Well, Doctor, thanks so much for hopping on with us this morning. Dr. Al Johnson of Johnson Medical Associates in Richardson. Again, his reminder to lock up those cartridges just like you would with any other medication to keep it away from your kids. He
said that 82% of e-cigarette exposure and toxicity this year occurred in kids ages 1 to 3. KLIF News Time 7:22.